On another note, I know that many in the media have been speculating about bruising on the president's hand and also swelling in the president's leg. In keeping with routine medical care and out of an abundance of caution, this concern was thoroughly evaluated by the White House Medical Unit. The president underwent a comprehensive examination, including diagnostic vascular studies. Bilateral lower extremity venous Doppler ultrasounds were performed and revealed chronic venous insufficiency.
Chronic venous insufficiency is a really common condition, particularly as we age. And what happens is you have valves in your veins that help to return blood to your heart. And over time, for a variety of reasons, those valves may fail, which can cause blood to pool in the legs. And a consequence of that can be leg swelling, it can be varicose veins, and in some more severe cases, patients can even get skin changes and ulcerations. So the causes really are multifactorial. So we think that some patients are more genetically predisposed. So oftentimes we do see that patients who have venous disease may mention they had it in their family, either, their mother or their father or someone related to them. It is more common as we age. So certainly as we grow older, you're more likely to develop the disease. There is a little bit of research suggesting that maybe patients who are taller are a little bit higher risk of developing the disease, and patients who are subjected to more what we call ambulatory venous hypertension, just more on their feet and putting pressure on those valves of the lower extremity, may also be at higher risk. Now, treatment for this tends to be compression stockings most commonly. In some cases, there are minimally invasive treatments that can be done to close off the vein, particularly if it's a superficial vein. We also advise patients to walk and increase the strength of their calf muscle so that can help return blood to the heart where the valves are not functioning so well, and also to periodically elevate the legs. But overall, a very common diagnosis and a very benign one as well. Sure, so many patients with chronic venous insufficiency don't even know that they have it. Because it's not picked up on more routine testing. Patients who are symptomatic will commonly come in complaining of varicose veins, which can be sometimes unsightly. They're the bumpy little veins under the skin that dilate as you stand up. Sometimes they can be aching, they can burn, they can itch, and in rare occasions they can bleed. The other most common manifestation we see with chronic venous insufficiency is leg swelling. However, I would caution leg swelling can be from a lot of reasons. So when I have a patient with chronic venous insufficiency and leg swelling, we often do look for other causes that could be contributing. And then the least common way that patients show up with leg swelling is with skin changes, where the skin just above the ankle bone tends to get darker, thicker, and then sometimes can ulcerate. So most patients with chronic venous insufficiency will have a pretty benign course. It's not a life nor a limb-threatening condition. In rare cases, patients may go from having varicose veins and leg swelling to developing some of those more severe skin changes and even ulceration, which can be quite painful and hard to heal. And oftentimes patients will have to miss work or become disabled because of that condition. But again, that's a rare number of patients that happens to.